Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 114,994 confirmed cases of COVID-19 in Canada and 38,910 cases in Ontario. Chatham-Kent has 233 cases and Sarnia-Lambton has reported 299 cases. Michigan now has 79,176 cases, with 12,475 cases being in Detroit. Today, we are reporting 2,275 cases of COVID-19 in our community, an increase of 30 cases from yesterday. 3 are workers in the agri-farm sector, 14 cases are in the community, and 13 cases are still being investigated at this time. 1,440 cases have now resolved, 712 people are self-isolating, and 14 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 34% are female, with 1% unknown at this time. Today, we are reporting another death. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes in COVID outbreak. In addition, there are now 12 workplaces in outbreak. 6 are in the agriculture sector and 5 in the manufacturing sector, and 1 is a construction workplace. Symptoms of COVID can range from mild to severe. And some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing chest pain, if you're feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olat Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to wechu.org and click on View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or the healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. I am sad to report our 71st death related to COVID-19. A woman in her 80s in hospital passed away yesterday. My sincere condolences go to her family at this difficult time. Last night, I spoke with the province in regards to the data we sent regarding provincial reopening. There were a number of discussions we had with the province late last evening and early in the night. While a majority of our cases seem to be related to the agri-farm sector in Leamington and Kingsville, there are a number of cases on the rise in the City of Windsor as well. Looking at those numbers, and based on the criteria including the number of cases in the hospitals, and factoring in the challenges in other areas who moved to stage 3, the decision was made to leave Windsor-Essex in stage 2. The province would like to look at the data for at least another week to monitor our trends and move to stage 3 when they feel it is safe to do. The province does not want to move us into stage 3 too soon and then have to move us back. The province has committed to revisiting the data over the next few days and move us back to stage 3 as soon as we are able to move forward safely. We have received many questions recently related to rules around the Quarantine Act. To provide greater clarity, anyone, regardless of symptom, who's coming into Canada by land, air, or sea is required to isolate for 14 days until the under the Federal Quarantine Act. This order for mandatory isolation is currently in place until at least August 31st, 2020. Mandatory 14 days isolation under the Act begins on the day an individual enters Canada. Individuals cannot end the quarantine early, regardless of being tested for COVID-19 and receiving a negative test. Any person exempt under the Quarantine Act, for example, for essential work purposes, is required under the Act to wear a mask or face covering in public settings where physical distancing cannot be maintained. The 14 days isolation period is to limit any potential transmission of travel-acquired COVID-19. When someone is exposed to COVID-19, symptoms can develop at any time during the 14 days incubation period. But on an average, it appears somewhere around 4th or 5th day since the exposure. Any person in self-isolation who develops symptoms of COVID-19 should immediately seek medical attention and contact the appropriate public health authority. For those subject to the Quarantine Act, direction will be given at the time when they enter Canada. To read the order, visit the Government of Canada website. To learn more about restrictions, exemptions, and enforcement of the Quarantine Act, contact Canadian Border Services. Thank you.
The conference is now unmuted.
We'll now take questions from the media.
We'll start with CTV.
Yes, good morning, Doctor. Just curious, what level is ideal for you guys for the province? Is there a magic number to get us into phase 3? I know you want to wait another week and all, but just curious.
Overall, when we were looking at the data, our case rates was significantly higher. I think I want to say at least 6 or 7 times higher than the provincial average, at least for the last couple of weeks. And that was one of the major barrier for us to consider us moving forward. Even recognizing that if we're breaking the data into separating the way that happened with the stage 2 reopening, the data still was not as favorable as we wanted it to be. So we will be looking at that data. We want to see the case rates coming closer to the provincial average or maybe somewhat acceptable, with the understanding that some case rates is increasing because of our agricultural farm sectors and also among the close contacts of many cases that we are seeing right now. So with our continued effort with the education and people restricting their number of close contacts, we should be able to bring that number down, and anywhere it is closer to the provincial average, that's generally the sign that the province is looking for.
Okay. Actually, now that you bring up education, I'll go off on a side topic, I guess. With education and perhaps more testing coming up on the horizon, with the fall and school and, people getting back to work and all that. Do you anticipate the St. Clair Sportsplex being needed again at some point in the near future?
So right now what we know is we are touching very close to the capacity of the healthcare system as well. That's another indicator that the province look for in terms of the health system capacity. We also understand that the hospital is also trying to resume some of the elective surgeries and elective procedures that they were initially it was deferred. So looking at what's happening, I think there has to be this conversation in terms of the ongoing need, especially the hospital beds, and their availability will be a question. If it exceeds the hospital capacity, then St. Clair College Sportsplex could be another option that can be looked at. But we'll have to wait and see what these numbers look like, and some of the conversation will happen at the hospital level and may require some input from public health as well.
Great. Okay, thank you, Dr. Ahmed. Appreciate it.
Any questions from Windsor?
Good morning, Dr. Ahmed. You mentioned that there are a number of cases on the rise in Windsor. So apart from the agri-farm sector, what sorts of things are we sort of doing wrong, and what can we change? What can the public change to do right to actually get us to move forward and get these case numbers down in the community?
I think some of the measures, as trivial as it may sound, but it is continues to be the most effective measure, and physical distancing is by far the most effective measure. And then if you add the physical distancing with the appropriate face covering, mask, cloth mask, or any procedure mask that people are using, you combine all those two things, and not congregating in large number, limiting your number of close contacts. Those are the things that would bring that number down, because if everyone is following all those measures, what we are trying to reduce is any transmission happening from one person to another. With more reopening, with more businesses out there, with more people outside, the likelihood of people coming in close contact with each other increases, and that spreads the infection very quickly. So I think that's what we are noticing is maybe it's a mental state that people are thinking that being in stage 2 or even considering to move to stage 3 is everything is back to normal. It's not. The diseases still exist here. The disease is still spreading, and we need to do everything that we've been doing so far. With the more reopening, I think there are more opportunities, so if people can enjoy what is open and with what is available to them in a safer manner. That's the only way to move forward.
And it was mentioned that one of the new workplace outbreaks is a construction company. Is that maybe like on the office side of the construction company, or does this involve work sites actually being shut down?
So I don't have that level of detail at this time handy for me, but typically, as we said, even with more workplaces opening, an individual, in many of the instances that we have been asked this question and people getting concerned, individuals, maybe they work at some place, but they may not be infectious by the time that they were working. So we do collect that information where these individuals are working, because we want to make sure that we are on top of any type of potential workplace outbreaks. But in most of these cases, the individuals are already off work for any reason, and they are self-isolating, either being identified as a close contact or as a high-risk exposure. So they are already self-isolating and potentially pose no risk to the workplace. But with this particular one, I don't have that level of detail. We just got the information, and we are still in the process of collecting all those details.
Okay, thank you.
Any questions from CBC?
Yes. Good morning, Dr. Ahmed. Why is it that Windsor-Essex has done so poorly when it comes to the spread of this virus in comparison to other regions in Ontario?
Well, I think we have done at least up until I guess end of May. We did pretty good, and our rates were relatively lower compared to the rest of the province, and our case counts were relatively lower. We are in a unique situation, especially with our border, international border that we have, and also with a significantly high number of temporary foreign workers in our region. And the border, as we know, the first action for this pandemic was to restrict your border movement. So we did that, but recognizing that still our border movement continues to happen, and with the Michigan opening and also our people crossing border, it poses unique challenges for us and poses more risk to us. So that's one thing. The second thing is, what we know is, even from the long-term care home and retirement home, that's another significant population that we have seen our cases rise in. And our provincial average, or the proportion of the seniors in our community, is significantly higher than the provincial average. That was another thing that drove some of those numbers up for us. And then we had a large number of these temporary foreign workers, and by far the most at-risk population based on their congregate living settings. We're talking about 8,000 to 10,000 people living in close quarters with very limited chance to do physical distancing. Even though it was a high risk identified right from the beginning, but there is no easy solution to remove that high risk condition of them living in these tight quarters or congregate settings. So hoping that, combined with all those efforts that we are seeing right now with different levels of government, the entirety of how these temporary foreign workers are living in the region, we can find a better solution for them to prevent any future infectious disease concerns. So I get that on paper when we're looking at those numbers, but those numbers do not capture what the reality on the ground is and what are some of our unique challenges. And that's why it is important that we have to work together, and we have to figure out a way for us to move forward. Everyone have to do their part as an individual, as the workplace, as the community, as the leadership. We all have to work together to do our part to contain it. And hopefully we will get there soon.
Do you think that the messages from public health are getting through to members of the community as well as community leaders here locally?
Well, that has been a challenge, and I think that's what we've been. We are trying to put that message out there, and since from the beginning of this pandemic, both Teresa and myself, we tried to be available to the public, to the media, to make sure that people are getting the right information that they need. There's a lot of misinformation out there for various reasons, and even in terms of what works, what doesn't work, and where our focus should be. Our public health messaging focus recognize the limitation of what we know from a scientific basis and what are some of the evidence-based recommendations that would work or would not work. Opinions and input from many people, as much as we respect their opinion and respect their input, but we have to go back to relying the expertise and the science part of it. And unfortunately, sometimes when this message is, there's a competing message, which goes against some of the messages or kind of dilutes the importance of public health measures, it creates those challenges. So I really hope that with the education and with the work and with our availability and our responses, people need to know who has the information or who has the expertise to share that information in a manner that would help them understand things rather than create more confusion or distract them from the real issue. The real issue is COVID still exists here, and some of the measure that we need to take, it still is changed. It's not different. We are waiting for some vaccine. We have got some promising results with some of the vaccine trials. We are waiting for it. Until that happens, we need to adopt to a newer lifestyle, which we are adopting most of the time with the physical distancing and face coverings and limiting the gathering. We just need to do that, as tiring and as boring as it sounds, but that's the only measure that we have seen it's been working, and that's the only way we can get it through. Compare it with any other country in the world, whether you're talking about Europe, whether you're talking about United States, or even any other Asian countries. That's the only way we can get through, and we need to understand that, and we need to rely on those expertise and the recommendations from public health.
Thank you, Doctor.
Any questions from Blackburn?
Yes, I was hoping to find a little more out about the woman that died in hospital yesterday. You mentioned that she was in her 80s. When was she admitted?
She was admitted pretty much around the same timeline. I want to say mid of July. And no, I'll let Teresa. You want to go ahead?
Oh, well, she was in hospital on July 24th.
Okay, so she wasn't in very long. Did she have any pre-existing conditions aside from being elderly?
Yes, she did.
Okay. Is she from long-term care?
Care, or is she living in the community?
She was a community member.
Okay.
Okay, then. And she was in the ICU, I take it.
I'm not sure about that, but
Okay.
yeah.
All right, then. Well, thank you very much.
Any questions from AM800?
Dr. Ahmed, when it comes to cases under investigation, I asked a similar question last week. I know you can't go back to it like you mentioned, but over the past couple of weeks, we've had a number of cases under investigation. Once your team wraps up those investigations, what's the best way for the public to find out if they were community, health, or agri-food? Would that be posted on your website?
Yes, so that information is updated on our website as we update that information, and also I go I go further deeper down into the breakdown in our weekly summary, which provides a good breakdown, even day-to-day variation of what is happening from a community, what is happening from an agri-farm sector, and what are some of the close contacts that are there. So. A combination of all that, it does provide that information, but even just tracking down day to day, every day, I think it's challenging to stay on top of it. But we do provide those updates on our website daily.
And then the agri-food sector, the workers that are in isolation, they do work in farms in Leamington and Kingsville, like it's been stated a number of times. But when they're in isolation at a hotel, there is a few hotels and motels in Leamington and Kingsville. Are they staying in those hotels, or are they being shipped to different areas, for example, the city or other areas that have hotels, or are they staying in Leamington and Kingsville?
So the general approach for that was the employer obviously is responsible for some of these housing arrangements for their workers who require self-isolation. Recognizing that with many workers who are in self-isolation and the logistics of organizing an assessment and ensuring that appropriate food is being delivered, appropriate security is in place. So based on that, the overall approach that was taken by the province through Ontario Health and some of the other partners is to identify some key hotel in the area where they can put these individuals for greater coordination and collaboration between different agencies. So that's the general approach, but an employer can still choose to say that if they are not sending their worker to the hotel, they can stay somewhere, but we definitely do not encourage that. We want them to be all in one place. And while they're self-isolating, generally speaking, they're not working. So they are just staying there. So having them in one place is of benefit, and it helps with the greater coordination and collaboration.
Thank you.
Any questions from the Windsor Star?
Yes. Good morning, Doctor. Among the cases in Windsor, what are we seeing there? Are these people going to large social gatherings and hugging each other and spreading it like that, or anecdotally, what's going on?
So obviously, there may be some data gaps in terms of what people are admitting and what people are not admitting. It's the challenge is always the number of people that we see as identifying as close contact. When what we are noticing is in the beginning, we may had like 2 or 3 close contacts identified with each of these cases, but now we are seeing in excess of 5 or 6 contacts per household, which eventually are converting into cases as well. So basically, that is telling us that people are not following the recommendations, and even just monitoring their symptoms and ensuring that if they're sick, they're not to go out to work. And stay home and physically distance themselves, get themselves tested. So the underlying thought is if we even just going by the definition of restricting your limited social circle to a minimum number, that's what is needed. I'm not asking, nobody is asking that you do not meet anyone. Please go ahead and meet your people if you want to, but meet them in a safer manner, ensuring physical distancing, ensuring that you're not in their personal bubble, ensuring that you're limiting your visits, you're wearing the appropriate face covering depending on the type of the meeting. So those are some of the things that we are finding out, and we feel that that's where the gap is, and we really want to make sure that people are doing that.
Are we getting a sense that people think, well, I haven't gotten COVID-19 yet, so I probably won't get it, that people think now that they're safe?
That's the other false sense of security I was referring to earlier on, is as more people, more businesses are opening, and we are talking about, how we're getting back to normal, and it's making people think that the threat is gone, but actually it's not. It still exists, and it's much more likely that you may come in contact with someone who is a positive case. Back in the time, like a month or a couple of months ago, when everything was practically shut down, the likelihood of anyone with COVID positive spending time outdoor or going into any of these places was low or to none. But now with the reopening and with more opportunities for people to congregate, the likelihood of anyone coming in contact with a COVID positive person is increased much more than a couple of months ago. So that's the kind of message that I think people need to understand, that the threat is still exists, and maybe it is much more than what it was before. So I think it's just the understanding, and it's just the following some of those public health measures. That's the only way that we can move forward.
Like Teresa said, 712 people self-isolating. Those are positive cases. You've got a lot more people self-isolating who are close contacts. So it seems the risk of contracting COVID-19 is probably higher now than it ever has been.
Will be an accurate statement to say.
Okay, thank you.
Any further questions from CTV?
All right, not to beat a dead horse here, but travel-related cases are part of the equation. I get that, but the numbers have been low recently. So, I heard you on Mike and Lisa this morning, and I'm just wondering, is it fair to say that we aren't moving into phase 3? A major reason why is because the situation in the agri-farm industry has yet to be resolved. Is that a fair and accurate statement?
I would say no, because the other consideration is definitely some of the cases that are outside of the agri-farm sector that we are seeing. Even the decision when it was made from us to move from stage 1 to stage 2 was on the fact that there were appropriate support system that was put in place to contain the viral spread in the agri-farm sector. And as we are seeing more cases in the agri-farm sector, obviously we are also getting more support from the province through different levels of government, different ministries, everyone coming together with EMAT here down, with Canadian Red Cross. So there are a number of partners that are trying to support the agri-farm sector. But what the concern is, anything that's happening in the community, it has the potential to increase and impact a large number of populations. So I think that's where some of the concern is, and it may be a combination of both, but more specifically on the community side of the cases that is of concern to the province.
Okay.
All right. Thank you.
Any further questions from Windsor?
No, thanks.
CBC?
No, thank you.
Blackburn?
No, thank you.
AMA 100?
Dr. Ahmed, when it comes to the schooling plan, I know you mentioned this past week and last week you and your team are in talks with the local school boards. I guess for you, I'm not sure if you have children or not, but if with 5 weeks away, maybe take your hat off as the medical officer of health, and as if you are a parent, would you be comfortable sending your children back to school right now in Windsor-Essex?
I do have children that are going to school, or obviously are not going right now, but I think it is important that we continue to support our children. This is the time that they need to learn, and they need to learn in a safer environment. So I think that's what we're hoping, that with the plans that we are seeing, with some of the restrictions that we are seeing, we should be able to safely open the school. And if, again, going back to individual responsibility, if all of us are doing our part in ensuring that we are a responsible citizen, we should be able to get through it. And we know that if we are able to continue to educate our children, that's the important thing that we want to do. They are at an important and critical stage. They need to learn. They need to understand what's happening, and there are a lot of opportunity that is currently being lost while they're staying home. But we want to make sure that they do it in a safer manner. So we'll continue to work with the school boards and with the ministry to make sure that the plan that is being put in place is there to protect our children, including my own children when they're going to school, so we can continue to move forward as a community.
The reason I asked that, because when schools were shut down back in mid-March, right after the March break, and correct me if I'm wrong here, I looked a little back at our stories. The numbers of COVID in Windsor-Essex at that time were fairly low at that time when schools were shut down. Now the community spread here in Windsor-Essex, and you mentioned a number of times today, is on the rise. shouldn't parents be concerned if you look at it that way?
Well, I guess as a parent myself, I'm also concerned too, and that's why it is important that even when we are sending our children, it can be done in a safer manner. Many of my children, they have their close friends that they hang out with their own classmates. So even if they're not going to school, they're still trying to meet with each other or stay in touch with each other. So if they are going there, I think what we need to ensure is that they're still keeping themselves safe. And we'll have to be creative. We have to be a little bit more restrictive, but also ensuring that they are able to do that. So I can understand as a parent myself what those concerns could be, but hoping that we can get through it, because our children definitely need to attend school and continue to for their development. It is critical that they also learn what's happening in this pandemic, and how they can continue to learn and meet their needs, educational needs.
Thank you. Have a good day.
Any further questions from the Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.
Okay, bye.
Thank you. Have a good day.